Hi, I'm Dr. Elston. I specialize in lipedema surgery in Gig Harbor, Washington. And today I want to talk about something that I've been thinking about over the last few months. And with plastic surgery, one of the things that we always think about is who is an appropriate candidate for surgery. And there's a lot of factors that can play into that. Age is certainly one of them. So for a patient that's too young, obviously they can't take part in the consent process or understand what surgery might entail. And for someone that is getting older, we have to start thinking about what are the risks and benefits of surgery, and is the surgery going to be too stressful on them? Will they be able to get the benefits from it? Can we be as aggressive? Things like that. So, one of the areas that I think patients with lipedema like to talk about is that they've known something has been wrong for many years, most of the time. I've had some patients that said that when they were in dance class as early as 8 years old, they could start to tell that their legs looked different than their peers. And while they may not have had a lot of the clinical problems of lipedema back then, I think it's important to understand that patients that are going to develop lipedema start to notice the symptoms very early on. And even though it may not be clinically relevant, they may not have the pain or the heaviness, the signs are usually there if you know what you're looking for. So what is the ethical early age to start taking care of this? We know that from other studies, lipedema, when you do the liposuction surgery, it will often stay off for at least 12 years and patients get pretty substantial benefits. I don't think anyone has really looked forward prospectively and studied a case control group and said, this group gets surgery, this group does not. How do they do over time to compare if the surgery itself gives significant benefits compared to no surgery and how those patients will change over time. So I don't think there's really any clear benefit that's been demonstrated scientifically, but I think most of us that do the surgery understand that the earlier you get to it, the better the patients seem to do. I think it also bears mentioning that the sooner that you have the surgery, the less likely you are for it to get significantly worse and to become disabled or have significant heaviness or tenderness from the lipedema. So with other patients that are minors that have plastic surgery, the two big procedures that I think about that could be considered cosmetic, but they're actually really reconstructive, one would be breast reduction. So a patient that is in their early teens or mid-teens that develops macromastia or enlarged breasts, that starts having functional pains, either they're being teased, they're having back, neck, shoulder pain, they're getting rashes. It can be really detrimental to their psychology as they develop, and also it's painful, or it can be heavy, it can cause headaches, all sorts of things. And in those cases, it can be justified to perform a breast reduction on a patient that's a minor. The parents are involved in the discussion as well as the surgeon, but that's something that's pretty routinely done, and it's not really taboo anymore. I think another surgery that's not really taboo is someone that has a nose with a large dorsal hump that's very obvious, or they have some features of their nose that they're not really comfortable with and it's affecting their self-esteem. It's totally commonplace and routine for a patient like that to have a rhinoplasty for cosmetic purposes and possibly also for breathing purposes if they had a break of their nasal bone when they were younger. But that's something that is totally commonplace. Not considered unethical. Again, it's just a discussion between the surgeon, the patient, and the parents. So what I'm wondering is, at what point is lipedema going to enter this conversation? If mom has lipedema and has the surgery and gains the benefits from it, I hear all the time from my patients, I think my daughter might have this. They're just not showing all the signs yet. So at what point does it become appropriate to say, yeah, I see the pattern. We want to prevent this from being a problem in the future. Let's deal with it now. So I think, it's easy to say 18 is a reasonable time to deal with it, because at that point the patient's a legal adult. They can make their own informed consent and sign for a procedure. And most patients that I see, they don't have really substantial lipedema before the age of 21 or 22. But I have seen some patients that report to me that when they started birth control when they were like 16 or 17, things really exploded and they got really bad. So, there might be a case for a couple patients that are younger than 18 to start considering doing lipedema reduction liposuction surgery. The other thing I think that comes up is that some patients that have been totally gaslighted for years and years about their weight because they had lipedema and they were told that you're just obese, you need to lose weight, and eventually it kind of gets into this snowballing situation where the lipedema gets worse, you get less mobile, you gain more weight because you're less mobile, you start to develop lymphedema, which makes things more swollen. And that tends to happen to patients that are in their 60s or 70s, where things can get really, really severe. At that point, having a severe problem usually requires severe correction with surgery, and that's often high volume liposuction in the hospital, overnight stays, sometimes large incisions. And when you get to be in your 70s, surgeries like that are no joke. I mean, they can take a really big hit on you. They can require a lot of recovery. They require substantial assistance from family. And if you have any other medical problems, those things play a factor into it. So the oldest patient with lipedema that I've done surgery on personally is 75 years old, and I don't have a hard cutoff, but I think when someone starts to be like 67, 68 with medical problems, or they're in their mid 70s with no medical problems, I think it's at least worth a pause and say, like, what are we hoping to get from this? What's your current level of function? If your current level of function is not great, are we going to be able to substantially rehabilitate you in a sense to get the heaviness off? If it's for pain, yeah, I mean, like, you can probably substantially help with the pain, because just the liposuction itself will help reduce some of the fat and the heaviness and the pain associated with that. But in terms of like restoring mobility, at some point, once it's gone, and you're probably not going to get much back. So I think it's just worth a discussion with the patients. Are you too old for this? And then I think in the future, we'll be discussing, hey, are you of an age now where you're old enough to have a discussion about, do you want to do something proactively for your health for patients that are minors or becoming 18? Will we be more accepting of patients needing this surgery preventatively to prevent 10, 20 years of them going through heaviness, pain, not being able to do the things that they want to do, kind of possibly taking more time off of work, not progressing in their careers? I mean, I think it's a little bit hyperbolic and dramatic right now, but I've got plenty of patients that would suggest that the sooner they could have got this done, they would have done it right away. So I know that there are patients out there that would desire to do that sooner, and I think it's at least worth a discussion at this point in time. So this was more of an opinion piece, just kind of some things that I think about with my lipedema patients. I'm sure that you all have some thoughts. Please comment below what you think. What's the earliest age that you would consider having this surgery if you had lipedema? How old do you think is too old? If you're thinking about your mother getting this surgery, what would you say for her? How would you counsel them on whether or not it's worth the risk or not? I'm just interested to hear what everyone says. If you've got any other ideas for videos that you'd like for me to give my opinion on, I love hearing myself speak, so I'd love to do any more videos on that. So thanks for your attention, and I'll see you next time.